If your client feels restricted, tight or stuck and deep tissue techniques aren't working, then connective tissue massage might be for you. Okay, today we're going to be looking at connective tissue massage. And before I kind of show you how to do the technique, we need to understand what it is. So you want to imagine, obviously, your body is filled with fascia under that superficial layer here. And you want to imagine it's like you're wearing a skin suit underneath. And what can happen is if your skin suit is too tight, then what's going to happen is muscles are going to feel restricted, they're going to feel tight, your body's not going to move how you want it to. So we're not necessarily going to be looking at working the muscles here, we're specifically going to be focusing on that superficial layer. And we're trying to basically stretch that suit out. So in order to do this, we need to use a flat hand and we're going to be kind of moving around and we want to find areas where it doesn't feel like that fascia or that connective tissue wants to move freely. And when we kind of find that point, that's where we're going to start applying our connective tissue techniques. Okay, so we've found an area where we've got a little bit of restriction through here. So just kind of around that medial border of the scapula, coming down to that inferior angle. So very common spot for a lot of people to get adhesions in that area. So what we want to try and do is, and a couple of ways we can do this. And the first method I'm going to show you, which is something I like to start with, is just a little bit of a stretch. So it can be you just kind of pulling in a direction over here. It might be that you want to apply that pressure coming back, but all we're going to be doing is just applying a bit of pressure. It can go opposite directions here. So it might be that you want to kind of go in here and do a bit of a push-pull. But the key thing is once you've got that stretch, we want to hold for around 30 seconds or so for it to be effective. So one of the things you want to understand is that fascia is what we call viscoelastic, meaning it can be stretched and adapt over time. So when we hold a gentle sustained pressure on that restricted area, it encourages a process called creep. Creep is when the tissue slowly lengthens and reorganizes itself. So you want to understand, obviously, this is going to help your collagen fibers align better and make the fascia less sticky and rigid. And already, I feel like we've got a little bit more movement back in that area. Another way we can do this now, and it's going to look very similar to one of your level 3 techniques, is with the roll-in, but we want to basically find that area. So just in here is where I can feel it's kind of sticking a little bit. So we want to pull that up. We want to hold this area. So just let me know, how's that feel out of 10 at the minute?
Probably about a 4.
About a 4? Okay, that's perfect. So we want to kind of be between a 4, I would say probably a 6 on this one. We're not going too painful. Once you've got that area up, what we're going to do now is slowly push the thumbs in and we're going to curl that round. So it's going to create like a bit of a moon crescent shape. And this we're going to hold for 30 seconds. Or alternatively until you feel a change happening. Okay, so I've been holding this for around 30 seconds now, and I can just feel some change happening. It's starting to give up a little bit. So again, once we've done that, have a little move around. But one thing we want to do is, because we're working superficially now, it's best to have yourself in a similar sort of stance to this. So your position should be something similar to this. We want to kind of get ourselves down low a little bit. And as we're applying that pressure again, because I mentioned, because it's superficial, we want to be at about kind of a 30-degree angle as we apply that pressure if we're doing the stretch technique, or alternatively if we're lifting. Because what we don't want to do is if we're coming from above and applying that pressure, we'll tend to work more into those deeper tissues. Whereas what we're trying to achieve here is all within that superficial area. So make sure you get yourself down nice and low. Find that area that needs that little bit of movement, a little bit of encouraging, and then we're going to stretch at that sort of an angle, okay? Because we want to be coming down and going across the tissue. So another area the client also struggles is just around here on the gastrocnemius. So kind of where your soleus kind of comes up just onto that gastro. So again, we're going to have a little feel around and look at where that flexibility is or where that flexibility isn't. And as we're kind of experiencing this, so I can tell you already from already assessing the client, is I know that all of this is going to need a little bit of encouraging. So as I mentioned before, where we want to come in at that little bit of an angle, get yourself nice and low, find that pressure, and then just let me know how this feels. And then again, we're just going to hold for around 30 seconds or so until we feel that little bit of change occurring. And what this is actually doing is helping to stretch just through here, restoring some of that fascia, lengthening it out just a little bit. And again, hold until either the client reports that that's easing off a little bit or until you feel some change occurring in this area. So just coming into this area, it's a little bit tight in here. So if I was to try that other method, you're going to notice there's not a huge amount that I can grab, but we just want to lift as much as we can, pull that into that crescent shape, and again, we're going to hold. So when would you use this with a client? So if the client comes in and they've reported any kind of tightness, pulling on nerve-like sensations, that would be a good indication that we could come in and use this technique. It might be that nothing else is working, none of the trigger points or deep tissue work you're doing. Might be that they suspect some fascial adhesions going on, or alternatively, it could even just be something down as simple as kind of movement restrictions with no kind of muscular cause to it. And that's been around 30 seconds. So again, we're going to come in, retest this tissue, and already there's a little bit more glide on there compared to what we had before. And again, one good thing to always do, retest both sides. Always assess one, compare it to the other to see if there's been any improvement in there at all. Okay, just one other thing you can do. When we're specifically doing the technique where we're going to kind of pull that tissue in, we're going to curve it around into that crescent shape and hold. After your 30 seconds, 45 seconds, however long you've gone for before you felt that change or adaptation, you can just finish it. We're going back to that level 3 technique where we're just going to walk it away, okay? And it's the same. We can kind of go through, walk that tissue away as we're pushing with those thumbs. It's even something you could potentially do to start the session. Just kind of find that tissue, roll it all the way. Because again, if there's an area where all of a sudden it's going to stick, you may find it from going through here. Because it might be an area that lifts, maybe it doesn't roll as effectively as some of the other tissue as well. So when it comes to performing this technique, a couple of things I want you to bear in mind is that if the client is dehydrated and the skin is really dry, you're not going to do this technique. It's not something we want to do. We don't want to be pulling that tight skin. So a key recommendation is make sure your client is hydrated. Recommend that, they drink a glass of water before a session. Always send them away, advise them to go and rehydrate as well. And another thing that we would avoid doing is doing this on any kind of broken skin. So if there's any kind of little minor cuts or anything like that at all, avoid using this technique because we don't want to re-break that, say the scar tissue or the scab that may have formed on that particular area and cause any more discomfort to the client.
So just to recap now, this connective tissue technique works on superficial fascia to release restrictions that affect movement, posture, and even circulation. It's a slow, focused technique that uses sustained pressure to create long-term changes in the tissue structure. By doing this, we can improve fascial health, we can restore freedom of movement and support the body as a whole, not just focusing on isolated areas.
And that is a wrap on another video for today. So if you liked the content, feel free to like, comment and subscribe. Let me know your favorite technique down in the comments. And as always, I will see you in the next one.